Ontario also announced it's retooling its vaccine strategy. And John Northcott is going to join me on that. John, really a shift on who's now right at the front of the line.
Yeah, absolutely. When the Premier says that he expects by the end of that lockdown period that we're talking about here, that 28 days, 40% of those over the age of 18 in the province will have had their first jab. Well, that's months ahead of what was the schedule as it has evolved. So ambitious, but it will not be so much those broad numbers as the drilling down, the move into essential workers, the move into at-risk neighborhoods. That's what a lot of the focus is now on this, not only making those individuals eligible, but also reaching out mobile units, going into those at-risk neighborhoods, going into areas, for example, organized through church groups, large employers as well. All of this being targeted, especially, again, in those hotspot zones. We're talking about Toronto and Peel, for example, where the schools are already closed. Teachers as well pushing to get more access to vaccines. Let's listen to one of them.
I have limited faith in our government's ability to roll out the plan until I see it, because just from personal experience as an education worker, we have seen promises made, promises broken. We have seen misinformation and disinformation from this government, and I think Ontarians deserve to know what the details are. But we are happy with the announcement. We are happy.
Premier Doug Ford pushing back against the suggestion by many that his government should have done more in terms of directing and in terms of locking down as well, saying it is those drastic increase in the number of ICU admissions just in the last few days that have urged him on and his government on in these actions. But he also points a finger at other groups, older people for whom vaccinations have been available for longer, saying in many cases they aren't getting them. Have a listen.
Ages 60 and older, we had over 1 million people that have not booked a vaccine. I'm going to be as blunt as I can. Your life is in jeopardy. 97% of the people that are dying are 60 years of age and older.
Let's look at, when we talk about, it's not only essential workers, but the hot spot zones and the areas where people, it seems, need these vaccines and in some cases aren't getting them for whatever reasons. We're going to show you two maps there. On the left-hand side, those dark, not only red, but almost black areas there showing, in fact, the highest case counts. Then on the right, the highest number of vaccinations. Essentially, an inverse. The vaccines, for whatever reasons, aren't getting to those where they are most needed. We'll show you another stark number that's come out by an organization that tracks these sorts of things. St. Clair and Rosedale, one of the wealthiest areas in the country. 22.4% of people there have received at least one dose. Jane and Finch, one of those hotspot, one of those at-risk neighborhoods, 5.5%, this despite 8 times the mortality and hospitalization rate. So it is that and those neighborhoods that these campaigns, in part, are aimed at. Heather?
John, stand by, because I want to ask you about the vaccination strategy in Quebec. That is another province that we focus on this morning, and another province where people are waking up under tighter restrictions. And let me just lay those out as well. In Quebec, as of today, masks are mandatory in all workplaces. They're now required for all outdoor sports and for outdoor gatherings with people from different households. This is for the red and the orange zones of the province. Gyms are now closed in Quebec's red zones. The number of people allowed to congregate inside houses of worship now limited to 25. That also applies to weddings and to funerals. So a lot has changed in Quebec as well, John, including, as I mentioned, the vaccine eligibility priority list. And what is the latest in Quebec there?
Yeah, let's focus again on essential workers there. The province saying that because they're expecting 750,000 vaccinations to come in, they will be able to deal with the most vulnerable, the elderly, those as well experiencing significant involvement with the healthcare system, cancer patients, dialysis patients, etc. But then a long list of those that are arguably essential. So teachers, and this is the Montreal area we're talking about specifically. prison guards, those who work with the mentally ill, those who work in meatpacking plants as well, something that will be looked at as this expands throughout the rest of the province, even more of those type of workers in the province as well. Also worth noting that the province is going to focus on, again, in the Montreal area, because that's how this is starting and then arguably moving out, you're going to have some form of identification to show not only that you work in that area, but you live there as well. So you'd have to fulfill both of those. Teachers would like it to apply to teachers right across the province, because they would argue that the risk with those 40 students for the prolonged teaching day makes them eligible. Let's listen to how people are reacting.
Obviously, for me, it's a disappointment, because since we're offering an essential service, I think we should be considered essential workers as well.
You know, I'd like to see grocery workers vaccinated, as well. But the fact of the matter is that nobody gets to sit in a room with 30 people at a time for 75 minutes at a time that I'm aware of. So that's why I think it's really important for teachers.
I'm happy to be able to protect the people I care about, but I'm also pretty upset that they're not considering a demographic that they pick and choose whether or not they're included.
So, Heather, watch for this across the country. What is a hot spot zone? What qualifies for someone to get vaccinated within that zone? And what is an essential worker? A debate that will likely play out right across the country.